Good afternoon, everybody. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. This event is one of our series of public health conversations, a regular series of events we host to engage with issues that matter most for health, to advance the ideas that shape a healthier world. At these events, we are joined by distinguished speakers who guide our thoughts about the forces that shape health, and by our audience who participate in our events through your comments. Thank you all for joining us. A word of particular thanks to everybody who helped make today happen. In particular, thank you to Meredith Brown and Alicia Noel for coordinating, and thank you to our co-host, WBUR CitySpace. The past 20 months have changed the world in profound ways. The COVID-19 pandemic ushered in a new normal, which we have all had to learn to navigate. With the emergence of vaccines, we are finally able to look beyond COVID to the next normal. Unlike the COVID era, the next normal will not be imposed on us by circumstance. Rather, it will be something we ourselves shape. Guided by the lessons of the pandemic, we have a chance to make the next normal radically healthier than any other time in history. Getting there requires having the conversations that advance our understanding of what matters most for health. Such are the conversations we aim to host with our next normal series of events, of which this event is a part. Today's next normal event focuses on education and health. The pandemic highlighted the importance of education to a healthy life and the costs of losing classroom time. Quality education supports health throughout the life course. I have long thought that the single best step for supporting a healthier world is greater investment in education. This means investment in early education, higher education, as well as in making education more broadly accessible to all, regardless of background, identity, or disability status. It makes sense then that education should be at the heart of our thinking about shaping the next normal in a post-COVID world. We are truly fortunate to have here to moderate our discussion of education and health, Deborah Becker. Deborah is a senior correspondent and host at WBUR. Her reporting focuses on the criminal legal system, mental health, and addiction. Her work has been featured widely on NPR and on radio stations throughout New England. Her work on the Massachusetts drug lab scandals was highlighted in the 2020 Netflix documentary, How to Fix a Drug Scandal. She has received numerous awards for her reporting, interviewing, newscasts, and investigative reporting. Thank you, Deborah, for joining us. I will now turn the event over to you.
All right, thank you, Dean Galea. Good afternoon, everyone, and welcome to this series of conversations about what we look at as we navigate life post-pandemic, particularly education, and what we've learned about education and how we might move forward. Our panelists tonight are experts on various issues related to education, and they'll bring you their perspectives and some things that we might consider as we move to the next normal. So just a little bit about format. Our panelists will make a short presentation and then we'll discuss some of their main points. After that, I will open it up to questions from the audience, and you can post your questions in the chat and we will bring them into the discussion with our panelists tonight. Unfortunately, our first speaker, Dr. Krishana Lloyd, had an emergency and she will not be able to join us this afternoon. Dr. Lloyd is a nationally recognized expert on the study and implementation of interventions to support early childhood professionals. We're sorry that we're going to miss her today, and we are sending her our best. We will hear first from our panelist, Dr. Morgan Banks. She's an assistant professor in disability and global health. Dr. Banks is a mixed methods researcher who's working on several projects on disability, and her primary research focus is in disability, poverty, and social protection in low and middle income countries. And after that, we will hear from Mr. Phil Beatty. He's Chief Knowledge Officer at the Times Higher Education. Mr. Beatty has 20 years experience working in global higher education, including more than 7 years as editor of the World University Rankings. Mr. Beatty was listed as one of the top 15 most influential in education by the Australian newspaper in 2012. And he's also described as one of the most powerful commentators and arguably policy actors on higher education. So those are our two panelists who will be presenting, and then we'll be discussing a little bit. And again, after that, we will open it up to your questions to pose in the Q&A. Dr. Banks, let's start with you.
Sorry, thanks very much, Deborah. I'm going to just share my screen. Okay, great. So my background is in, as Deborah mentioned, in disability research. So I'm going to be talking a little bit about how we've adapted methods and practices for disability research under COVID-19 and the implications that has for dissemination, both for education as well as more broadly for policy and planning. So before I start, I just want to acknowledge that what I will be presenting today and discussing today comes from the expertise and input of my many colleagues who are working on disability research across 10 different countries in Europe, Asia, and Africa. So this is drawing on their input as well. So COVID-19 has brought about disruptions to almost all sectors, and that includes research. And even before COVID-19, people with disabilities have often been represented in research due, for example, to the lack of accommodations in research designs and research tools. And now more than ever, research is very important to understand the implications of the pandemic on people's lives and to inform policy and planning. However, some of the changes that have happened to research practices, particularly with the switch to remote research, risks further excluding people with disabilities, meaning that their experiences and concerns may not be reflected in the research outputs that are designed to affect policy and planning for both the COVID-19 pandemic as well as into the future. And this is just to say that 15% of the world's population are people with disabilities. So the inclusion of people with disabilities is really essential, as without the inclusion of people with disabilities, we will not be able to get accurate responses to COVID-19. So I'll talk through a bit some of the key considerations for adapting methods and practices. So this is going to include decisions on in-person versus remote data collection, choosing and adapting platforms, if going forward with remote data collection, implications for recruitment, adaptations to support participation of people with different types of disabilities, considerations for confidentiality, particularly when that involves sensitive topics, and inclusive and effective analysis and dissemination. And I have a picture here which reads "Nothing about us without us," and this is just to say that people with disabilities must be included throughout all stages of the research process, from the design to the implementation to the dissemination of the outputs. So the first consideration for data collection during COVID-19 concerned proceeding remotely or in person. So for all of the countries that I mentioned at the beginning, almost all of them had some periods where restrictions did not allow for in-person data collection. Even if in-person data collection was allowed, disability overlaps with other characteristics that could put people more at risk of severe COVID-19 outcomes, including hospitalizations and death. So in the UK, for example, people with learning disabilities were 5 times more likely to be hospitalized from COVID-19 and 8 times more likely to die from COVID-19. So even if it was possible to proceed in person based on national guidance, that might not always be advisable for the specific study group. So at a minimum, if proceeding in person, there needed to be considerations for safety, including personal protective equipment, vaccinations and testing if available, as well as giving participants the option to choose to participate remotely if that was their preference. Balanced with safety is the first and foremost concern, but balanced with that is also feasibility. So many of the settings that we were working in were in low and middle income countries. And a major issue was around the availability as well as familiarity with different forms of mobile technology needed to support data collection. And this also had implications for providing needed accommodations, which I'll talk about a bit further later, as well as how to collect that data safely for the participant, and which was a particularly concern for sensitive topics, such as, for example, domestic violence. So if proceeding with remote data collection, choosing and adapting appropriate platforms was a key concern. So globally, people with disabilities have lower access to mobile phones and internet compared to people without disabilities. So in the UK, for example, data from 2018 found that 23% of people with disabilities did not have access to the internet compared to 6% of people without disabilities. So that's quite a big difference. Additionally, beyond mobile phones, we also, for many of the settings, needed video-based communication for certain participants. So for example, people with profound hearing impairments who use sign language would need a video-based communication such as Zoom or WhatsApp to participate, but the availability was low in many settings. So a lot of people had access to a basic cell phone with text and audio capacity, but not as much a smartphone or internet. However, on the flip side, if individuals had access to the required technology, remote data collection could result in increased access to research for people with disabilities, and it could be preferable even. So some participants with, for example, Asperger's or autism reported that they preferred remote data collection to in-person, as did some people with mobility limitations who would have otherwise perhaps had to travel to a office or center to take part in a research study. There were also implications for recruitment with the shift to remote data collection. So on one hand, conducting research remotely could expand the geographic reach. So it was much more cheap to reach remote communities rather than if you had to go in person and there'd be associated travel costs. However, there were some additional challenges with conducting research remotely in terms of getting a representative sample. So pre-pandemic, in many of the settings that we've worked in, it would be common to go door to door, and this can help to reach hard to reach populations who might not have access to a phone or be in government registers. During COVID, this was not possible, so recruitment was often based through organizations, such as non-governmental organizations or organizations of persons with disabilities. So this had pros in that those organizations could help in terms of facilitating access to needed accommodations or ensuring participants of the legitimacy of the study. However, there was sources of bias in terms of who is associated with those organizations. So for example, in the UK, many participants associated with organizations were predominantly white, whereas in other settings, they often were higher education, better connected. So you could see that it still is missing some people from taking part in the research process. There was also an issue of gatekeeping for people with disabilities. So often the mobile phone was not necessarily controlled by the person with a disability. It might be a family member's or a friend's. So that could influence decisions to participate as you had to go through an additional person. And then I think all research studies have struggled with response rates with online data collection, given that numbers on file might be out of date, or people are more skeptical of an online request to participate in a research study. For both in-person and remote data collection, it's important to provide adaptations that support the direct participation of people with different types of impairments. So that could be sign language or closed captioning for people with profound hearing impairments, the use of simplified tools or interview schedules for people with intellectual impairments. And so there was a need to adapt those guidelines when conducting research remotely, particularly around video conferencing. So there was some useful ad hoc guidelines that were provided by some of the participants. Formalizing some of those is something that would be helpful going forward. There were also issues in that there were possible adaptations, but they would coincide with the lack of needed technology. So it was very common in some settings for For example, a person who required sign language to communicate wouldn't have a smartphone or internet in order to allow for video conferencing. There were sometimes workarounds such as texting instead, or having a family member who was present act as an interpreter, but this was not available in all the cases. And just to note that for both in-person and remote, it's always important to ask about accessibility in advance. Some of the studies that my colleagues have worked on involve sensitive topics, and this has been a global challenge for all research during COVID-19. So ensuring confidentiality is very challenging when participants are taking calls at home and family members are also at home. So it's difficult to ensure that they are able to answer privately and that others won't overhear. This was difficult. I know some colleagues use some strategies such as asking yes/no questions and then allowing the person to elaborate if they felt that it was safe enough for them to do so. It's also important for research studies to have adequate referrals in place in case safeguarding issues arise. So there were disruptions to many services, and that included potential referral services, so whether that was child protection or mental health services. So if those services had gone online, it was important to ensure that they had accessibility measures in place so that people with disabilities would be included. And then finally, in terms of inclusive and effective analysis and dissemination. So I've mentioned several of the limitations that arose because of the methods of data collection during this time. So very important to acknowledge those in any analysis and forms of dissemination. The move to online dissemination has been preferable for some people with disabilities, particularly people with mobility limitations who would struggle to go to an in-person event. But others are being left behind with only remote modes of dissemination. So we've had to think creatively about texting study findings or providing leaflets to ensure that the study findings are reaching back to both participants as well as other people with disabilities. The involvement of organizations of persons with disabilities is also very key here. And then for sensitive topics, there was some concerns around the safety of online forums. So when it's important for people with disabilities to represent their stories, and this is true for people without disabilities as well, but with recordings and open participation, there are just additional things to consider there to make sure people can represent themselves safely. So for reflections on moving forward, even as vaccinations become more available and we hopefully are moving on to a less acute stage of the pandemic where countries are opening up, it does seem very likely that there will be some continuation of the shift to remote ways of working. And it's important to ensure that people with disabilities are not left behind, and to acknowledge that remote working is preferable for some people with disabilities. So further research is needed to formalize best practices for including people with different types of impairments and in different settings, with different access to different modes of technology in research, as well as more broadly, including in education and work. And strategies are needed from a policy and planning perspective to reduce the digital divide between people with and without disabilities. So that's my presentation, but I am very happy to take any questions during the discussion period.
All right, thank you so much, Morgan. Thank you for that. Next, we'll go to Phil. Phil, let's talk a little bit about higher education and COVID and our new next normal and your thoughts on that.
Thank you very much, Deborah. Yeah, so I was going to just reflect much more on the sort of broader institutional strategy side of things, really as a sort of leadership challenge and also a challenge around how we open up our universities. I think one of the things that's perhaps been most fascinating in this pandemic, a positive element to a terrible situation that universities found themselves in, is this idea that they are capable of remarkable agility, capable of implementing dramatic changes very quickly. There was this old saying I used to repeat a lot that said that universities were great at changing the course of history through their discoveries, through their inventions, but they're actually very bad at changing a history course. You know, there's too many committee meetings, there's far too much slow moving, you know, often medieval systems of governance that holds universities back and stops them being agile. So first of all, I think there's a remarkable positive in the sense that universities responded incredibly well, primarily to the existential element of continuing to provide education to many millions of students globally through a pandemic. So that's a really fantastically positive thing, I think, that needs to be harnessed. But in terms of the many challenges and lessons, I thought I would focus really just primarily on one core issue, and that's the issue of equality. I think, you know, we all know that the pandemic has shone an extremely harsh light on inequalities in our societies, not just in terms of existing inequalities, but also exacerbating inequalities in terms of the financial hardship that some parts of our communities have suffered disproportionately. The health consequences have obviously hit certain communities much harder. You know, in London here, of course, it's the poorer communities have been much more badly hit. The minority ethnic groups have suffered disproportionately. So the pandemic has really, for me, exposed much more brutally the existing inequalities and exacerbated inequalities. And my sense is that there's a great opportunity here for universities. You know, fundamentally, universities are about giving people life chances. They're about transforming opportunities for individuals. But I also think they need to really focus on their social role and to make sure they are inclusive and they're able to open up to all of those who have the opportunity and the ability to benefit. And that includes, you know, traditionally excluded groups, primarily from lower socioeconomic groups. But obviously, as we've heard from Morgan as well, those with, you know, neurodiversity differences and disabilities, we need to be much more inclusive. And I think there's a multitude of really positive opportunities from my perspective. The first one is, of course, the pandemic has forced universities to be more flexible. They have shown they're able to deliver their education in many different ways. I think we've seen, of course, the rapid move to remote access, I think the permanent shift towards blended approaches that actually a lot of the university leaders that we've spoken to and we conduct surveys have suggested there will be no return to the old ways. There will be a permanent embrace of all the positive elements of digital remote learning. And I think probably the longest term, the most significant benefit from that perspective in terms of equality is going to be about flexibility. The student gets to be much more in command of when and how they access their education. So, for example, those students with caring responsibilities, those students who perhaps are mature students with wider familial responsibilities, who need to conduct paid work to fund their studies, hopefully they will be able to access their higher education in a more personalized, positive way. I think obviously there should be, perhaps there's some resistance to this, but there should be some cost benefits. There are ways, I'm thinking there'll be many disruptors coming into higher education to say we can deliver degree level education in a more cost effective way. There might be some significant pushbacks from traditional providers, of course, who have driven the residential experience, the 4-year full-time campus-based experience, and there's huge benefits from campus-based education, of course, but I think there is the opportunity for disruption in terms of the actual fees that are charged, the costs of delivering, the speed of delivering. I think there's benefits around credit accumulation and transfer, bite-sized education, the opportunity to dip in and out depending on your social and personal circumstances, and of course, ways of reaching people with disabilities with more tailored approaches. I think there's a possibility as well of democratizing international education, making international education more accessible to those who are less able to afford to navigate the visa processes, to pay extremely large relocation fees, as well as overseas tuition. And the final point, I think, around the great opportunities for me is around the data and the technology itself. I think there's a real myth, a bit of an unfortunate stereotype of a student, stuck in a basement of their mum and dad's house on taking Zoom lectures, and the idea it's an inferior experience. There's no doubt there is some poor experience out there, but I think there's also been some outstanding examples of fantastic online delivery. And I think what that does as well is it lends itself to, albeit a controversial element, which is the super personalization of education. There's a lot of evidence before the pandemic that universities were harnessing data, harnessing information about students, learning, the timings, even keystroke monitoring around areas they get stuck on, challenges around if students their interest is waning. If students are at risk of potentially dropping out, we're able to target intervention, target support. I think there's a huge opportunity to actually put more resource into supporting those more at risk of non-completion. So there's some great opportunities there. And I think if universities embrace this opportunity, if they really do harness this moment to properly widen access. And actually, Anna Marie Kause, the president at UW in Seattle, I was speaking to her at a session at the World Economic Forum last year, and she talked about this idea of equicovery. There can't be just a recovery, it has to be an equality-driven equicovery. And I think actually if we get it right, we can actually do so much good for wider society. We have huge social divisions in the US, of course, the similar problems in Britain. We can really start to actually bring truth-seeking and evidence and critical thinking to wider communities. We can support information campaigns that we can fight against the disinformation, the anti-vax movement, the anti-mask movement, the anti-science movement, the climate denial movement. We can bring a more informed debate into public, and we can start to heal some of these deep social divisions where people are actually rejecting evidence, rejecting truth, rejecting higher education, suggesting that universities don't value. And a final point I'll make, just because obviously great to open it up to conversation. The final point I'd make is I think that universities are actually starting to rediscover their kind of core social purpose, their public duty. You've had institutions, of course, like Morgan's, the London School of Hygiene and Tropical Medicine, doing extraordinary things to help the fight against COVID. I know the president of the London School himself got COVID whilst he was also leading the fight against it. You've got institutions like Johns Hopkins University providing extraordinary public data and information to help the modeling, help the policy response. Obviously, Oxford University here in the UK, got to roll out one of the prominent vaccines in an extraordinary time, and not to mention all the economists and social scientists who can really support us in terms of building back better, getting to the new normal. So universities discovering their public good, their social mission, and their duty and their ability to make the world a better place. And within that framework, you mentioned, Deborah, very generously, quite a flattering biography of mine that's been floating around, that this influence I have, it's not me at all. It's the power of university rankings. We produce university rankings. They shape behavior. They, frustrating as it may be, often can guide policy decisions, guide strategic decisions, shape universities. And one thing Times Higher Education is committed to is actually flipping rankings more towards social good. So in 2019, we launched the impact rankings, which is based on universities' delivery of the Sustainable Development Goals. So we actually reward universities' social impact, and that's every single SDG from good health and well-being through to climate action, through to equalities. right through to peace and justice. And we're starting to capture evidence, build the evidence base, create data to celebrate and reward universities' contribution to the SDGs, to the public good, and try and provide a framework to actually highlight good practice and share good practice. So I think personally, this pandemic, although it's been absolutely, a great human tragedy and a terrible thing, we have to harness the positives, learn the lessons, and try and come out, as the cliche says, in the Conservative Party conference taking place in Manchester in England right now, to build back better. We've got to do that. So I hope some sort of slightly broad reflections help inform some of the conversations. Thanks very much for inviting me to share my thoughts.
Okay, well, thank you so much, Phil. I just want to remind everyone listening that we are going to be opening up for questions very shortly. We have a bit of an abbreviated program, so you can put your questions in the Q&A part of the Zoom. It's at the bottom of your screen, so if you have a question for one of our panelists, feel free to type it in there, and we will try to get to as many as possible. Morgan, I just wonder if I could ask you, because you've done a lot of research in a lot of other countries, and I wonder if there is a particular anecdote that you'd like to share with folks about what you may have learned, how other countries have dealt with folks with disabilities that you think provides a lesson to the rest of us in how to research some of the effects. I know it's very early, but really, what strikes you in all of that, and what would you like people to know about?
I think some of the studies that I've been involved in, I think what has made a big difference, and this goes beyond just COVID-19, is the involvement of people with disabilities in the research team. So I think that there's a need for more researchers with disabilities, and some of that reflects the exclusion people with disabilities have faced earlier on in the education system. But for example, one of the study locations was in Ghana, and several of the data collectors themselves had profound hearing impairments. And so there was just a lot of sort of creativity and innovation that comes from having the lived experience of disability that a researcher without a disability might not have thought to put in place for having some adaptations to make research methods accessible for people with disabilities during COVID. So I think that just really underlines the importance of including people with disabilities as part of the research team, in addition to as research participants.
Mm-hmm. The numbers that you cited were striking. I wonder if you could just talk about that a little bit again in terms of the number of population, or the number of people in our population identified as having a disability, and then those affected by COVID, and what we know at this point, because I found that to be really surprising. And what do you think some of the reasons are for those numbers?
Yeah, so I think that there, there's research emerging that the pandemic, not just the direct effects of COVID, but the indirect effects of shutdowns and lockdowns has disproportionately affected people with disabilities. So I presented the numbers on hospitalizations and mortality, which is a very direct effect, but looking indirectly, for example, there's been massive disruptions to health systems overall, and people with disabilities tend to, on average, have a higher need for healthcare because they have the same healthcare needs as a person without a disability, as well as the need for disability-specific healthcare, whether that's rehabilitation, getting repairs to assisted devices like wheelchairs or hearing aids. So those were disruptions to health services and social care services have really impacted the participation of people with disabilities. I think I'm forgetting the second part of the question. Could you remind me again?
And how the pandemic has affected people with disabilities in particular, and the total number of people with disabilities in our population, and sort of how we're analyzing that and trying to get a better understanding on what's happening.
Yeah. So the 15% figure comes from the World Health Organization. They had a landmark report in 2011 that I think they're updating, but Yeah, the 15% was from surveys that were conducted across many countries in many different regions. Disability does increase quite a bit with age, but there is still a high number of people with disabilities that would be of school-going age, working age, and so there's also adaptations that need to be put in place based on the life stage of a person with a disability.
I would like to bring something up that someone has asked, because I think it's an interesting sort of broad question about your work, and it also gives me an opportunity to remind people once again, if you do have a question, you can post it in the Q&A, and I will go through those in a bit to bring in your questions to this conversation. But Morgan, I thought this question was fascinating. What types of disabilities do you consider, and if you consider various types, do you find differences in responses from those you've looked at in your research? And can you explain that a little bit?
Yeah, so the research that I tend to focus on tends to be cross disability. So we want to include people with all different types. So whether that's an intellectual or cognitive impairment, physical, sensory, psychosocial, and there are quite, people with disabilities are a very homogeneous group. So impairment type is certainly one area where we see quite different responses. So both in terms of the data collection methods. So I think we've seen particular exclusion when we move to remote data collection for people with hearing impairments, and people with intellectual or cognitive impairments seem most at risk of exclusion. I mean, there are certainly adaptations that could be put in place, but there's the need for that technology. I'll also say that disability and poverty are highly linked. So people with disabilities are much more likely to be living in poverty. And so that then impacts the ability to access the types of technology that are needed to participate, whether that's internet, a phone, smartphone. So there's a lot of sort of downward exclusion that I think is playing out in this pandemic. So I think the pandemic has exacerbated what were pre-existing inequalities. So people with disabilities were more likely to be excluded from education, from access to needed healthcare, from decent employment. So if you look, I know Phil was mentioning the Sustainable Development Goals earlier, and that calls for disaggregating all those indicators by disability status. And I think that's very important as we continue throughout the pandemic to see all the different types of impacts that the pandemic has had on reaching those goals for the whole population, but also is that been a disproportionate impact on people with disabilities.
Phil, I know you spoke about this disruption in education and this unbelievable ability of bureaucratic organizations. There is a joke here in Boston that the BU in Boston University stands for, bureaucracy, and there's and it's a large university. Then large universities can be difficult to move sometimes, but proved in this case during this pandemic that they were able to pivot quickly. However, how do you come back? Right. And how do you also make sure that your business model is sustained, because everything is different now. And I wonder what you expect we'll see in terms of real long lasting changes to higher education, and how do universities adapt and make sure that they will be able to have the necessary resources and demand the prices that they've been able to demand when we've got these big changes coming?
Yeah, it's a big question. I think one of the things that's come through very strongly from the conversations we've had with university leaders, and we run an annual leadership survey, a couple of hundred university presidents from across the world, and we ask them how things are changing. And the one thing that they were very clear on was that they will be seeking to keep hold of a blended approach, that they won't all rush back to just purely in person. Now, in the UK, there's a bit of a row going on. The government seems to think if you don't go back fully in person, you're somehow shortchanging the students and you're letting them down. The value for money argument seems to be focused on remote is cheap and in person is high quality. But I think there's a real much more nuance there. I mean, we were already seeing perhaps the traditional large scale lecture of 300-400 students in a room, all passively listening to the sage on the stage, as they say. That model was already being challenged and disrupted. It's not the most effective way of learning. You know, if you can put more of that on demand, access that from anywhere in the world, from any institution in the world, and focus more on the small group learning, on problem solving, on different types of learning. I think that's happening anyway. So that's a sort of pedagogical change that I think is positive, and I believe overall will enhance the student experience. I think the challenges come really to the real disruptors, when you start to say, okay, how much was your tuition fee, how much was your attractiveness based on a big brand that perhaps relies on 1 or 2 centuries of history, relies on the ivy clad walls, relies on the physical environment? How much of it was about what you deliver in teaching, or how much was it about what you deliver in terms of the wider social capital of the campus experience, the networking? So the idea of maybe potentially challenging individual brands and reputations, and I think it paves the way more for disruptors. So really focusing on what you actually offer. And I think, you know, students are becoming more savvy consumers, demanding more data. We provide the data for the Wall Street Journal college ranking, and we were very keen to say, let's look at, rather than reward exclusion, let's reward inclusion. So we look at the diversity of the student and faculty body, but most importantly, when we look at graduate outcomes, we look at value add. So it's not just the schools that cream off the leading students, and then they all waltz into the top jobs. This is about the journey they're taken on, the distance traveled, the taking people from less privileged backgrounds, from more diverse backgrounds, and actually bringing them on a journey to success. So much more focus on actual real outcomes, and much less focus, I think, on traditional brands. And the big one, I guess, is the sense of, can disruptors genuinely offer something that is more relevant to employers and at a lower price point, and something that also, gives that flexibility? So there's a huge issue around lifelong learning. You know, graduates increasingly don't really graduate. There's a school in Singapore, the National University of Singapore, that says when you graduate, you're still enrolled for 20 years, because we will actually deliver you a full 20 years worth of access to our facilities, of access back to into our classes, because lifelong learning is the norm. So there's lots of disruptions. Yeah, absolutely. And it's like you must never stop learning. We're moving into an incredibly uncertain future. The new jobs market is changing rapidly. The digital space has accelerated, a decade's worth of digital acceleration in terms of retail, in terms of how we live our ordinary lives, accelerated rapidly. The future economy, future jobs, the rise of automation, the rise of AI, dramatically changing the future. So that need to also provide constant upskilling and reskilling is there. So the university model, I think, is under increasing strain, but I would go back and say there is something uniquely special about the university environment that actually allows more than just training, more than just skills. It allows that reflective, critical thinking, problem solving approach. So I'm not suggesting the model is dying. I'm just suggesting there's a lot of disruptors, a lot of challenges, a lot of other people, particularly a lot of startups and investment floating around this idea that is education the next big thing that we can really, really shake up. And I'm not convinced. I love universities. I think they're utterly special and unique, but I certainly think they have to adapt and be very aware of all these new challenges and new models.
And ranking universities, I mean, that's hugely controversial, especially when you're talking about disruptors and you're talking about, this new way of doing business and how we learn. And this isn't just COVID related. I mean, rankings of universities have been controversial forever, right? How do you say one is better than another depending on who you're teaching and who you're serving? So I think it's really interesting when you mentioned the Singapore example of allowing for more lifelong learning and realizing that it's a journey. But if you're really moving toward that, then I guess, how do you sort of balance being able to measure that and then rank it accordingly?
I think the Times Higher Education solution, people will possibly think this is quite cynical, but our solution is actually to do a lot of different rankings, and there's no right answer. There's no definitive best. So, the ranking that I think we were most famous for is the World University Rankings. It's over 1,000 of the world's leading research intensive universities, and we're examining 14.4 million research publications, 108 million citations. It's a huge piece of work around research influence and the research profile of the world, the shifting geopolitics of knowledge, really. So that one is about global research universities that are hiring faculty from across the world. They're publishing research in world journals. They're tackling global shared problems. They're collaborating globally. We also do the domestic ranking for the Wall Street Journal. We also do something in Japan. We also look at all of the SDGs separately, and that allows us to say, okay, you can be ranked literally just on your contribution towards climate action, or you can be ranked literally on your contribution to gender equality. So for us, it's actually the more data, the better, because there is no right answer. There's no definitive list of best to worst. There shouldn't be. We should move towards profiling. We should move towards contextual analysis. We should move towards putting the data in the hands of the user, whether that's a policymaker or a university president, or whether that's a student consumer. Hand the data to the user, let them personalize it, and accept that there's not a right answer when it comes to best colleges lists.
And in the latest rankings, I noticed for the past few months, you've published some articles about Asian universities on the rise. Can you explain that a little bit and why you think that is on the rise in these rankings?
Well, I think that's actually something I think might be accelerated by the pandemic quite dramatically, actually, because if you look at the changing or the dependency on international students, the US is obviously the world's leading recruiter of international students, and they provide, substantial income with their tuition fees. The UK is now, without question, dependent on international students. Up to 20% of some of our schools are full of international students. They are utterly essential for the economic benefits they bring. They're helping sustain some of our institutions. Of course, they bring far greater benefits than just money, but they are actually financially necessary. Australia, I think those institutions, will suffer longer term harm from the pandemic. Those students will not all be able to travel, will think twice about traveling. There is a bit of a bounce back, but there's perhaps some permanent change around the perception of welcome, the rise of xenophobia, the rise of nationalism that's affecting mobility. So students, I think, increasingly, primarily from east to west, students who want to study abroad go from Eastern nations to Western nations, particularly China. That might all change. There'll be much more east to east mobility. There'll be much more benefits of talent flow within the East. So I think that actually might accelerate change. But the main change really has just been investment. Economies like South Korea, they've transformed the entire national economy by becoming the most knowledge intensive nation on the planet in terms of the money they pump into research and development, the investment in education, the investment in research. South Korea's economy has gone from rural to manufacturing to knowledge. China's doing something very similar, but obviously on a much grander scale. So it's all about investment. It's all about soft power. It's all about winning the race for the fourth industrial revolution, I think, around particularly themes like AI in particular, these core new technologies that will shape the future. And Asia is investing incredibly heavily, and Asian universities are rising rapidly up to compete with the best in the US that still do dominate, I have to say.
I want to just remind folks, we're going to open it up to some of your questions as well. If you have them, you can post them in the Q&A section of this Zoom meeting. And we have some questions in there now. I have one, Morgan, for you. This is a question about multi-country studies and the different perspectives of disability in different countries. And how do you address that in your research when you do have differing ideas depending on where you're doing the research? How would you answer that question?
Yeah, so disability is actually quite hard to measure for that reason, that there are different perspectives on what is considered a disability in different settings. So for example, for research that I've been involved in that's been in more say, agricultural settings where manual labor is very prevalent. A very minor physical impairment will be seen as quite disabling, whereas a more profound hearing impairment may not be considered as much of a disability. So there is an element of it being a social construct. The current guidance for measuring disability is to avoid asking binary questions such as, do you have a disability, yes or no, as that leaves too much to interpretation, but to rather focus on an individual's functioning. So asking questions such as, do you have difficulty walking, seeing, hearing, to focus on the activity level. That then means that people identified as having a disability through those measures may not consider themselves as having a disability, but it does provide, it tends to provide less biased, more internationally comparable figures.
Mm-hmm. Another question for you in the Zoom Q&A, Morgan, is one that says we've been finding that parents of people with disabilities have suffered from not having support during COVID, not having institutional and psychosocial supports. Have you, and can you talk about that a little bit about the parents of those with disabilities?
For sure, there's definitely been impacts on parents and other forms of caregivers. So looking at education, perhaps less so higher education, but more children's education with the shift to remote learning, even in places like the UK or the US, there have been many reports that I think it's been hard for all parents to support their children in remote learning, but the lack of inclusive education in the shifts to remote learning have been particularly challenging for parents who are juggling childcare responsibilities as well as their own work or household responsibilities. So that's just one area of impact for caregivers, as well as when children or adults don't have access to the needed health and social services, that then puts a greater workload on parents and stress.
Mm-hmm. Phil, I'm wondering, this is also a question about public health education, and this is also in the Q&A, and I think obviously it's an appropriate question to be asking in this particular group right now. And this question is essentially saying, given the challenges that public health has had responding to the pandemic, and of course, looking at the political divides and what's happened with that, and the power of various industries, in education as well. Is there a need to change or revise public health education? And what have we learned in the pandemic about that? That might give us some insight about moving forward to our next normal.
Yeah, I think there's a sort of almost a fundamental sense that we need to change education itself to really address some of these really deep problems we've experienced. Probably epitomized most by the activities at the Capitol in January. This huge sense of alienation, this huge sense of people being divorced from the norms of democratic society, people being really sort of taken in by fake news, taken in by conspiracy theories, taken in, particularly that has very strong health implications in terms of people's take up of vaccinations, etc. People's sense of how much of a genuine issue COVID is, etc., etc. So that almost feels like goes right back to the basics in terms of we have a divided society. A lot of these issues do divide along those who've benefited from higher education, those who haven't. In the UK, a very similar sort of delineation around the Brexit vote. Sort of these deep divides seem to come back to education in general, and that sense of alienation, that sense of disenfranchisement, that sense of distrust. And my sense is that actually that comes almost more through general levels of inequality and exclusion and social exclusion and exclusion from educational opportunities at the more basic level. But as far as public health education goes in terms of educating the public, it's incredibly hard if you've got that deep level of mistrust that's sort of seeded at a much more deep level, because public messaging, public communication is going to struggle to get through. But so in terms of specifics around public health, I think there's obviously I'm in no way an expert at all in this area, other than to say we need to really start to work hard around how we communicate science, how we communicate the messages, how we use social media, how social media is starting to morph and change the nature of debate, how it's challenging mainstream media in terms of where people get their information from. So I almost think it goes back to the core education that everybody receives at the sort of K-12 level. I think needs to include more issues around critical thinking, more areas around the evaluation and the understanding of facts and evidence, this filtering and consumption of information, critical thinking skills all need to be sort of really deeply embedded at an earlier level, I would say. So it's not a very straight answer, but I think that's where it's coming from, and that's the solutions feel incredibly big and deep rather than specific changes to specific public health education in that sense.
Right. Because when you spoke about, looking at universities and their social purpose, right? And what we do moving forward from this pandemic. And then we also consider these deep divides that we see illustrated all the time. I understand that education and critical thinking needs to be a focus on education well before the university level. But I guess what do universities do in this instance? What's the way that universities, or the steps that universities can take to make sure that they are looking at a social purpose in this very divided place we find ourselves?
Yeah, and a lot of that's going to come down, I think, to really working hard on communication. We've seen more perhaps more than at any time in centuries. We've seen the profound public good of universities. They're driving forward vaccinations in record time, the volunteering, the effective treatments, the social science. Universities have stepped up and delivered extraordinary public good through the pandemic, specifically in terms of tackling the pandemic through treatment, through vaccination, through the sort of economic rebuild. But we somehow don't manage to communicate that to the wider public. That's not seen. There's this extraordinary sense of people not valuing their universities in some way. So I think there's a huge amount of communication to do, whether that's much more outreach, much more community engagement. I think universities perhaps often need to look at their own communities as well. A sense of, I don't want to use cliches, and I know it's perhaps unfair, but the sense of universities being ivory towers, inaccessible to their neighborhoods and communities. We really have to just do as much as we possibly can to keep communicating, celebrate and champion and express the great good that universities provide beyond did you get a degree in a good job or did you not get a degree in a good job. Much wider benefits. Keep talking, keep shouting, and keep engaging.
All right. Well, I think that we are just about out of time because we decided to abbreviate the program a bit because one of our panelists was not able to make it this evening. No more questions in the Q&A. So I just want to say thank you to Phil Beatty, Chief Knowledge Officer at Times Higher Education, and Dr. Morgan Banks, Assistant Professor in Disability and Global Health. Thanks to both of you for being with us.
Thank you.
Thank you very much for having us.
And I'm going to turn it now back over to Boston University School of Public Health, Dean Galea. Dean Galea.
Well, thank you very much. Thank you, Morgan, Phil, and Deborah, if I may. As everybody might imagine, given that my day job is actually dean responsible for a school, I have been listening to this quite intently, not purely from an intellectual interest, but also from pragmatic interest. I was actually very taken by some of the comments about education and how we are rethinking education, or need to be rethinking education in the next normal. So thank you to the panelists, and thank you, Deborah, for outstanding moderation that I think was immensely thought-provoking. I feel like I have perhaps more questions now than when I started, and I think that's a sign of a really good panel. So thank you for the conversation. Thank you to the audience for participating. Everybody, stay well. Have a good evening.